Well, colon cancer is difficult enough for patients and their families, especially when surgery is required. But sometimes an infection after the surgery can add insult to injury. A Knoxville doctor is on a team working to reduce those infections. Dr. William Gibson is with Premier Surgical Associates in Knoxville. Really appreciate you being with us. And we're going to talk more in a minute about your team's focus. You deal with a number of issues, a number of patients, and different types of cancer. But you do focus in on colon cancer. Let's begin by talking about how common infections can be and very briefly how they occur.
Well, in patients undergoing colon surgery for cancer or other reasons, the rate across the country is about 15% of those will have an infection. And the important part of that is that it can prolong the patient's hospital stay, even require them to have additional operations, and it certainly prolongs the cost of health care both to the patient and to the hospital and to insurance companies.
This is one of many focuses your team has. Tell me about the group of doctors that you're collaborating with and your overall mission.
Sure. This colon wound infection reduction project that you mentioned is what we call our first boots on the ground project that was born out of a larger group, a consortium of now 21 hospitals across the state of Tennessee. Wow. Started as 10 hospitals that implemented this bundle to reduce colon infections, but the bundle and the overall project to improve care in surgery patients has been so successful that another 11 hospitals signed on in 2012, so we've got good representation across the state. And it's not just doctors, because hospital administrators and quality officers and infection control officers are all in favor of this because it improves outcomes, which is better at every level of health care.
So you're really focusing in on the patient.
That is correct. That is our focus. I'm a physician, and that is the goal of this. The overriding goal of this is to improve outcomes for health care for surgery patients in Tennessee. You
mentioned Tennessee. Is there a future plan to take it beyond the state lines into a region or across the country?
Yes. In fact, we have a sort of a parent company, as it were, called the National Surgical Quality Improvement Program, which is a program created by the American College of Surgeons. So this does, there are models for this that exist across the country, but we in Tennessee with our statewide consortium are pretty unique, and we're doing some pretty groundbreaking stuff in terms of the collaboration we have among numerous hospitals in the state.
Well, we certainly appreciate you being with us today, and you'll have to keep us posted on your work.
Thank you. It's my pleasure.
All right, Dr.